Today we're going to talk about abdominal pain. Now you kind of think that a topic like abdominal pain really wouldn't need much talking about. As humans, we've all experienced abdominal pain, whether that might have been a dodgy meal out of a restaurant, or we've had temporary pain from a change in bowel function, for example. So that sort of episodic or intermittent phenomenon is something that we're all familiar with. We know it's uncomfortable, we know it's unpleasant, and we also know that it's going to pass. I guess what I wanted to explore today was really talking around those situations where the abdominal pain might become more persistent. Now, there might be particular reasons why that may be. We kind of divide it up in the medical world between what we call organic causes, which might be related to specific things such as polyps, or it might be related to the gallbladder or other conditions such as that. Or perhaps even the more common example is what we call a functional disorder, and that's a disorder such as irritable bowel syndrome, where there is a change in the way that the bowel actually contracts, what we call the motility of the bowel, and that can actually produce not only pain, but it can also produce things like bloating or an alteration in bowel function, such as constipation or diarrhea, or actually alterating states between constipation and diarrhea. And we think that irritable bowel syndrome is something that can develop over time, and it can start with something as small as constipation and then progress from there. And it can also be related to stress. And there's probably a whole group of people that actually end up with it where it's not particularly clear to us why that actually occurs. So that's one of the common causes. We'll talk about some of the treatments in a moment, but that's one of the common causes of chronic abdominal pain. Now, there are other conditions such as inflammatory bowel disease, commonly called Crohn's disease, and also a separate one called ulcerative colitis. And these are situations where there's actually inflammation in the bowel wall, and that's usually treated with medications and sometimes even requires surgery to treat that. The other one to talk about is a condition called OIBD, which is an acronym that stands for opioid-induced bowel dysfunction. And it's a situation where somebody is taking opioids, maybe for a different pain condition, and they start to develop some abdominal pain. And it's actually part of that concept where the bowel is not contracting and relaxing, then contracting and relaxing in the normal pattern or the normal flow. And so pain actually occurs because contraction is occurring in a section that's already contracted instead of it actually relaxing. So they end up with abdominal pain. Now, if the response of the individual is to say, I need to take more opioids to treat this actual abdominal pain, then the condition is self-perpetuating or gets worse over time. Hence why the main treatment for opioid-induced bowel dysfunction is that the opioids must be removed. It doesn't have to be removed immediately, but it needs to be scaled down to the point where it's ceased so that normal bowel function can start to occur again. And it's not uncommon in a pain clinic for a patient to turn up with chronic abdominal pain and they are taking codeine or morphine or oxycodone for that, and we realise that's actually what we're dealing with. The upside is that it's actually treatable. And so once recognised, then we can institute a reduction strategy to try and normalise things. Now, the other one that we want to talk about is another acronym, and this acronym is called ACNES, ACNES, which stands for Abdominal Cutaneous Nerve Entrapment Syndrome. It's a bit of a mouthful, isn't it? Now, what we're talking about here is a situation where, again, there is chronic abdominal pain, but the pain is not coming from inside the abdomen itself. It's not coming from any of the organs, the colon or the small bowel or the liver or the kidneys or anything like that at all. It's actually coming from irritation of the nerves that line the abdominal wall. So we have 3 layers of abdominal muscle, and between 2 of the layers actually sits a little collection of nerves. Now, if there is sufficient spasm, sufficient compression of those muscles, the nerves actually get bruised. And when they get bruised, they give rise to pain, a particular type of nerve pain, but it's felt in the abdomen. And certainly to the person or to the patient, it's very difficult for them to determine that that's actually coming from their abdominal wall rather than from inside their abdomen. There are specific clinical examination tests that are done, very simple bedside tests that will distinguish one from the other, and then there's specific treatments that can be applied to that to actually resolve that irritation of the nerves in the abdominal wall. Some of the time that's an injection of local anesthetic and a steroid or a cortisone. Other times we will actually look at pulsing those nerves under ultrasound just below the skin to actually block the pain of that. So again, it's very effectively treated, but it is imperative that a physician, whether it's your general practitioner or your gastroenterologist or your abdominal surgeon or your pain specialist, are actually examining you to determine whether or not that is actually present. Probably the next group to talk about is talking about abdominal health, if you like. And that might be a strange thing, but really when we look at each component of the body, before we get to a disease process, there is a range between health and unwellness of that segment, if you like, and then if that goes on, eventually a disease process can occur. So we can talk about respiratory health, cardiac health, we can talk about abdominal health. And here's a couple of facts to think about when we start to think about abdominal health. The first is that the organisms that we carry in our gut are far more voluminous in number of cells than the cells in our human body. So we carry just about 1 kilo of microorganisms through our gastrointestinal system or through our gut. And they make up way more than an order of magnitude more than our actual only cells. So you can almost sometimes think, are we the carrier vehicle for them, since they outnumber us 10 to 1? But that's a little bit of a side issue. But the point is, we have evolved together with these organisms over about the last 500,000 to 1 million years as hominids. And so they exist with us as a host. We provide them with an environment to live inside our gut, and they also are providing us with actual processes that they engage in. So fuel comes in as food into our gastrointestinal system. They go to work to produce various substrates. So they digest and they chew on that food. Now, that's useful because we get some of that food then absorbed into our body as a substrate, but they also produce a whole range of chemicals, an entire cocktail list, if you like, of chemicals that are also absorbed into our body, some for good and some for bad. And the type of microorganisms we have determines often the type of disease that we will get in advance. So, for example, we can actually sample the type of microorganisms, and we can have a look at that and see if it's a particular type of set of microorganisms, that person might develop Alzheimer's disease in 5 or 10 years' time. So we can predate the onset of a disease by seeing a signature. Hopefully over time we'll be able to develop treatments to alter the particular set of microorganisms into a more beneficial set. We don't have that really at the moment. We're still in the process of understanding that. So at the moment, what do we recommend? What do doctors recommend? What do nutritionists recommend? They recommend having a healthy gut bacteria load. And it turns out that consists of eating the type of food that we evolved on for the last 500,000 years. Not the kind of highly processed, Western, refined junk food diet that many of us from time to time eat or continuously live on. So getting back to those whole foods, getting back to fruit, getting back to vegetables, minimizing the amount of sugar, minimizing the amount of highly processed meat intake, all that seems to be associated with healthy gut bacteria. And that then means that those gut bacteria are producing more of the good stuff for us and less of the bad stuff. So even if you don't have abdominal pain, even if you don't have any abdominal disorders, what you're eating will help influence what diseases you will have in the future. And that's a really profound thing to think about. That next thing, we've got a choice when we walk into the cafe or the deli, we've got a choice between a donut and an apple. Maybe we actually want to go for the apple.